Hi, my name is Adriel William, and today's video is regarding my experience from 2020 when I gave my dental school interview at UCLA and got accepted at that year. And I wanted to make this video actually last year and share my experience. But due to being a part of a dental school, being a student, and my personal life, it just got delayed and delayed. But hopefully today you'll get to hear some feedback or some experience of mine that I had during that time. And one thing I want to tell you, in 2020, that's when COVID hit in. So everything was going virtual. And for me, I already had given 4 interviews at that time, virtual interviews, and had 3 acceptances. So by this point, I was planning to give interview for UCLA and UOP. My confidence was comparatively different now. And when I was doing my research, I got to see things a little bit differently. Because one of the things I want to share with you, and regardless if you're applying to any dental school or if you're being interviewed at any dental school, this is something which you will find really helpful. And before I go ahead, kindly do like and subscribe to the channel. That's comparatively give me encouragement to make more videos. So coming to the point, that when I was doing my research and until now, I've realized that every dental school in the United States is given a curriculum which is approximately uniform. So there's an organization called CODA which gives accreditation to all the dental schools, and they provide them what courses they are supposed to teach and what clinical things each student have to do before they graduate. And approximately most of the schools have a uniformity in this throughout United States. There might be some deviations or differences, but all across, mostly you will see a uniform courses for advanced standing students. But one of the things that I've learned over time is that the culture of the city, the culture of the state that you're studying in do seep into the school as well. For example, if you're going to school in San Antonio or you're going to school in NYU, the culture of the state or the city is comparatively quite different. The culture of Chicago is very different. So studying at NYU and Chicago are big cities, very cutthroat culture. Everybody's fast, everybody's direct to the point, and you live according to that. And even your patients, the approach they bring on is comparatively same. And even your faculty, the approach they have towards life and towards dentistry and towards teaching does matter, because it varies in the city they live in. So when I was going through this process and understanding that, and that's one of the reasons I picked Colorado, because I was more inclined to be in this kind of culture. But LA, comparatively, now coming to UCLA, LA is considered to be one of the most progressive city of the United States. It's one of the party city, I would say. It is heavily influenced by Hollywood as well, and they say about 1 out of 5 or 6 people is a YouTuber, influencer, or a vlogger. People have a lot of cosmetic surgeries done up there, and everything's quite upbeat. And when I was sitting in the school interview, when I was actually listening to their presentation, because the current student give you a presentation, I could actually feel that vibe as compared to other schools like Indiana, Colorado. So I could see the culture of the school is comparatively very different. And for the lack of better term, most people say UCLA as a whole. I'm not talking about the dental school, I'm not talking about the advanced standing program, as a big state university, or the UCLA being a big university in the city, is considered to be a party school as well. So the good point is, comparatively, the students at UCLA, I found them to be, it's not that they don't work hard, it's gruesome, the whole program is very tough, but I've seen them more happy. They have, I do comparatively saw that they had a bigger smile on their face as compared to other dental schools, which is a good thing. So one of the things that I saw, that the faculty was comparatively quite nice. They had a lot of diverse faculty as compared to people who were taking my interview, the program director. They were comparatively more diverse. And one of the things I can tell you from my experience of interview, mine and other people who have given last year, is that the interview is heavily focused on your personality, your resume. So 80% of any dental school interview will be asking you who you are, tell me about yourself, how do you manage stress. And I want to focus on this part. Almost a lot of school will ask you, how do you manage stress? Give us a story when you dealt with stress. Any life example when you had to deal with stress, and how did you overcome it? Over and over again, I see this pattern being asked in all the dental schools, and I made a video on this. You can go ahead and watch that too. But I would suggest prepare for this question. It will be asked from you in the dental school interviews. They can ask you about your strengths, about your failures, about your weakness, uh, these kind of questions regarding you. And then they will also focus on your resume. So what kind of experience you had in the past, what kind of dentistry did you practice in the past. They can ask you, tell us about experience when you dealt with the apprehensive or a hysteric or a complicated patient. What was your approach? What did you learn? So go through your resume, go through your personal story, and see what questions can be asked. And here's the thing which I tell to most candidates that I work for interview preparation: create stories out of your life. I'm not saying create false stories, but have stories out of your life, because we as humans, we remember things when things are told to us in stories or parables. If you look at most of the religious text, it is written in stories. The things that we remember are written in stories, whether it's Abrahamic stories, whether it's Moses' story in the desert, whether it's Ramayana. Whatever you're reading, you remember things through stories. So when you're sitting in an interview and you have to give an answer, this is something I suggest over and over. Bring something like a story, an experience from your life, and try to present it in a way which is audible to the American ears. Because here's the thing, some story that was relevant in Pakistan or maybe India or maybe Middle East might not be relevant in US. So you have to be somewhat of culturally sensitive and understand what story will make sense to that ear, and also provide them the moral or the context or the lesson I'm trying to interpret. So over time, you need to find stories from your life and you have to answer this question in that way. And I've actually made several videos on this, so you can look at more videos at my channel from this regarding this. So this was one part. Other part that I suggest every candidate that you should be prepared is for ethical questions. And I've shared a lot of videos on ethical questions, but you should know the most frequent questions that are asked from an ethical context for any dental school. And UCLA might ask you, might not, but you should be prepared. Just as you're prepared about your personality questions, you should be prepared for this question. And they can be: somebody was cheating in an exam, somebody was stealing at work, somebody was being racist, somebody fought with you, somebody not doing their homework. And there's a list of other questions that can be asked. And I'm gonna hopefully share a link in the description. You can watch for that. So that's the second part. Now here's the third most important part. UCLA interview is gonna be most probably a panel of 1 or 2 people who are going to ask you questions, and most of them are faculty, and they will ask you questions from which are regarding clinical dentistry. And one of the things that I've learned in US while studying is that most general dentistry questions are going to be from restorative and prosthetic dentistry. So you should be able to see a radiograph, interpret or come with a differential diagnosis, and think about the potential treatment that you can provide. Obviously, it doesn't have to be 100% up to the level of GV Black or something like that, but you should have approximate idea of how to deal with the clinical situation. And I know people come from various experiences. So some people might have been experienced in dentistry, general dentistry for the past 10 years. And then there's somebody I knew at UCLA who were fresh graduate and got accepted. But you need to have some kind level of like exposure and understanding of basic clinical dentistry as well, because that was one of the most important part in the interview. Thirdly, they will ask you in one way or another, you should be prepared. Why do you want to be a part of UCLA? That's the number one. And the second thing is, what will you bring to the team if we accept you as a candidate? So you should be prepared about both of them. And one of the things I would say, most candidates go through the website, read about the university. It has a lot of research and all the programs they have, all the chapters or bodies that are in the school extracurricular activity. But here's the problem: they just read that list and they just quote it or just read a script in front of the interviewer. I think that doesn't make a good impact, because you want to personalize it. Because if somebody did some community work, or they've been part of the LA, or if they have done any internship at UCLA, you should relate things that are much more personalized. Then it makes a stronger impact. But these are main things that are asked during the interview side. And beside this, they had a virtual bench exam, which they had in the previous years, and I think most of the virtual bench exam which are asked for any dental school throughout the United States right now for advanced standing students, they will heavily consist on restorative and prosthetic dentistry. You should know about crowns, about margins, about preparations, about class 2s, and you can look at the ADEX criteria, Google CDCA ADEX criterias, and you can read them in detail. And if you want to do in more, I would say, detailed preparation, you can watch some Stevenson dental solution videos. I think Professor Stevenson did a great job. And if you want my help personally, you can reach out to me. I'm planning to do an interview preparation course for candidates who are lined up for the interview. Or even if you have any other questions, you can reach out to me, and hopefully I'll get back to you as soon as possible regarding your questions. And except for that, I'm trying my best to make more videos, some meaningful videos that could help you out. Do give your feedback. Do comment if you want certain topics I should cover in my videos. And before you do that, do watch the list of videos that I've already made, because if you're going to ask me how to write my personal statement, well, I've already made a video on that. But do mention in the comment what kind of topics you want me to cover, and keep me in your prayers or wishes, and hopefully I'll see you in a more meaningful video. Thank you.